High school senior Nick Weaver plays a tune on the guitar for his mom, but it was just last year that the teen couldn't remember a few chords he'd learned months ago.
I'd put my fingers where I think they'd go, and then I'd play, and then it didn't sound right at all. So I'd look at it and be like, what's wrong? So I'd look it up, and be like, oh, and then I never forgot them again. But
Weaver did forget, a side effect from the blow to his head he got during a Harvest Preparatory Academy football game where he was stuck at the bottom of a pile.
I was lifting my head up, and he jumped on the pile, and I just banged my head on the ground, and then I don't remember, but what I've been told was the next play I played, I was like 2 seconds late.
Emergency Department head Dr. Philip Richmont at the Yuma Regional Medical Center says that the slow reaction and memory loss are clues that the brain's been injured.
People are practicing, there's a hard contact, most often helmet to helmet, and then someone either passes out or they feel dizzy or they're confused, things of that sort. Keeping in mind that sometimes the symptoms are not always immediate.
Dr. Richmont says that football players might feel invincible because of their helmet, but that just isn't the case.
I think when you're wearing a helmet, it gives you that sort of false confidence that you can really, ram your head into something, and to some degree, that's the nature of the game.
As a junior in high school, Weaver said that's the exact feeling he had going into that life-changing game.
I had a bunch of confidence, and gradually every game I'd get better and better. I thought, I'm unstoppable now.
This October, in just 1 week alone, 3 teens died across the nation as a result of a head injury from a football game. Center for Disease Control says between 2001 and 2009, hospital rooms saw about 173,000 teens for concussions related to sports. But what happens when they survive like Weaver? Physical therapist Joshua Lindquist at the Yuma Rehabilitation Hospital says depending on how serious an injury, athletes face potential hardship like regaining mobility.
A person may be unable to get out of bed, may be unable to stand up. They may be unable to get in and out of a shower. In more minor cases, maybe more things like just minor weakness, fatigue, just like a little bit of a lack of coordination.
Lindquist demonstrates a few exercises that would help head trauma patients regain movement and coordination.
Yep.
But like in Weaver's case, players can temporarily or even permanently lose cognitive skills too.
Maybe they have difficulty concentrating or focusing or remembering certain things. There can also be mood changes.
Weaver recalls going through those symptoms after the homecoming game.
I was all in tears and everything for nothing. I was just bipolar. I was very angry, and then I was very, very sad, and then I was like, I'll get over it, and then I got really mad again, and then I got home, and all I wanted to do was go to sleep. So I went to bed, and then in the morning I really couldn't speak.
Findings from the Center for the Study of Traumatic Encephalopathy at Boston University show that repeated head injuries can cause long-term problems. That could make recovery feel impossible. A difficult recovery and a newfound perspective of the loss at stake, Weaver decided not to go back to football.
But he doesn't want to get another injury, because that could be the one that destroys his life.
Reporting in Yuma, I'm Ella Sogomonian.